I want to talk to you today about something that doesn't get discussed nearly enough, even though it affects millions of people around the world. It's about intimacy, connection, and what happens to your body when you go through extended periods without sexual activity. And before we dive in, I want you to know something important. There's absolutely no judgment here. Whether you're single, in a relationship, choosing abstinence, or just going through a phase where sex isn't part of your life right now, you're exactly where you need to be. What matters is understanding how your body responds to these changes so you can make informed decisions about your health and well-being. Now, I have a question for you, and I'd love to hear your thoughts in the comments below. Have you noticed any changes in your mood, energy, or overall well-being during times when you weren't sexually active? Drop your experiences below because your story might help someone else feel less alone. Let me start by addressing the elephant in the room. There's a lot of misinformation out there about what happens when you're not having sex. Some people will tell you that you'll face serious health consequences, while others claim it makes absolutely no difference at all. The truth, as is often the case, lies somewhere in the middle. Your body is incredibly adaptable, and while there are some real physiological and psychological changes that can occur during periods of sexual inactivity, none of them are permanent or catastrophic. What I want to do today is walk you through the actual science so you can separate fact from fiction. First, let's talk about what happens in your brain. Sexual activity triggers the release of several important neurochemicals, including dopamine, oxytocin, serotonin, and endorphins. These are your feel-good chemicals, the ones responsible for pleasure, bonding, stress relief, and that general sense of well-being you experience after intimate moments. When you're regularly sexually active, your brain gets accustomed to these chemical releases. When that activity stops, you're not getting those regular hits of neurochemicals, which can lead to some noticeable changes in your mood and emotional state. Many people report feeling more irritable, anxious, or even mildly depressed during long periods without sex. This isn't all in your head. It's a real biochemical shift. However, and this is crucial, your brain doesn't just shut down production of these chemicals entirely. You can still trigger the release of dopamine and endorphins through exercise, spending time with loved ones, pursuing hobbies you're passionate about, eating foods you enjoy, and even through laughter. Your body has multiple pathways to these feel-good states. Sex is one powerful route, but it's not the only one. What you might notice is that your stress levels could climb a bit higher than usual. Sexual activity is a proven stress reliever. It lowers cortisol levels, which is your primary stress hormone, and the physical release combined with those neurochemical rewards creates a powerful relaxation effect. Without that outlet, you might find that stress accumulates more easily, or that you need to be more intentional about finding other stress management techniques. This is why I always encourage people to have a toolkit of stress relief strategies, whether that includes meditation, exercise, creative expression, or time in nature. Now let's talk about something that concerns a lot of people: your libido, or sex drive. Here's where things get interesting, because your body responds differently based on whether you're someone with a penis or someone with a vulva, though there are common threads too. When you go without sex for extended periods, your libido doesn't just disappear overnight, but it can definitely decrease over time. Think of it like muscle memory for desire. When you're regularly sexually active, your body and brain are primed to think about sex, notice sexual cues, and respond to arousal more readily. When that stops, your system can sort of go into a lower gear. For people with penises, testosterone levels can be influenced by sexual activity, though the relationship is complex and somewhat bidirectional. Regular sexual activity, including orgasm, can help maintain healthy testosterone levels, which in turn supports libido, energy levels, mood, and even muscle mass. When you go through long periods without sexual activity, some studies suggest testosterone levels might dip slightly, though your body still produces testosterone regardless. The bigger issue is often psychological. When you're not engaging sexually, you might think about sex less often, which creates a cycle where decreased activity leads to decreased desire, which leads to even less activity. For people with vulvas, the changes are similar but manifest differently. Estrogen and progesterone play major roles in sexual desire. And while these hormones aren't directly triggered by sexual activity the way some people think, staying sexually active does help maintain blood flow to the genital area, keeps vaginal tissue elastic and healthy, and supports natural lubrication. When you go through extended periods without sexual activity, you might notice that vaginal tissue becomes less elastic, natural lubrication decreases, and arousal might take longer when you do eventually engage in sexual activity again. This is especially true for people going through perimenopause or menopause, where estrogen levels are already declining. Here's something important, though. These changes are reversible. Your body doesn't forget how to be sexual. It might just need a little more time and patience when you do decide to become sexually active again. Think of it like taking a break from running. If you stop running for 6 months and then go out for a jog, you're not going to perform at the same level you did before, but with consistency, your body remembers and adapts back. Let's address something that worries people quite a bit: the use it or lose it concern. Is there any truth to this? Well, partially. Your genitals need blood flow to stay healthy. For people with penises, erections aren't just about sexual pleasure. They're actually a health mechanism. When you get an erection, oxygen-rich blood floods the erectile tissue, keeping it healthy and functional. You actually get erections during sleep, called nocturnal erections, precisely for this reason. So even if you're not having sex, your body is still doing its maintenance work. However, regular sexual activity or masturbation does provide additional benefits in terms of maintaining function and sensitivity. For people with vulvas, similar principles apply. Sexual arousal increases blood flow to the clitoris, vagina, and surrounding tissues. This blood flow is essential for maintaining tissue health, elasticity, and nerve sensitivity. Regular sexual activity or solo sex helps keep these tissues in good working order. Without it, especially as you age, vaginal atrophy can occur more quickly, meaning the tissues thin out, become less flexible, and produce less natural lubrication. But again, this doesn't mean your sexual function is gone forever. With patience, proper lubrication, and gradual reintroduction of sexual activity, your body can bounce back. Now I want to talk about something that doesn't get mentioned enough: the immune system connection. Believe it or not, regular sexual activity has been linked to improved immune function. Research has shown that people who have sex once or twice a week have higher levels of immunoglobulin A, or IgA, which is an antibody that plays a crucial role in immune function, particularly in mucous membranes. When you're not sexually active, you might miss out on this particular immune boost. Does this mean you'll get sick more often? Not necessarily. Your immune system is influenced by so many factors, including sleep quality, nutrition, stress levels, and exercise. Sexual activity is just one piece of a much larger puzzle. What about physical fitness and body composition? This is an interesting area because sex is, after all, physical activity. Depending on the intensity and duration, sexual activity can burn anywhere from 70 to 150 calories per session, and it definitely gets your heart rate up. It's not going to replace your gym routine, but it does contribute to overall physical activity levels. When you're not having sex, you're simply missing out on that particular form of exercise. The impact on your overall fitness is probably minimal unless sex was a very regular and vigorous part of your routine. But it's worth noting that you might need to be slightly more intentional about other forms of movement. There's also the matter of pelvic floor health, which is crucial for both people with penises and people with vulvas. Sexual activity, including orgasm, causes your pelvic floor muscles to contract and relax. This is actually a workout for these muscles, helping to keep them toned and functional. Strong pelvic floor muscles are essential for bladder control, bowel control, sexual function, and core stability. When you go long periods without sexual activity, you're not getting this particular form of pelvic floor exercise. The good news is that you can maintain pelvic floor health through targeted exercises like Kegels, which involve intentionally contracting and releasing these muscles. Let me talk about something that's often overlooked: the cardiovascular benefits of sex. Sexual activity is good for your heart. It gets your blood pumping, improves circulation, and can even help lower blood pressure over time. Some research suggests that men who have sex regularly have a lower risk of heart disease compared to those who don't. For women, the cardiovascular benefits are similar, though the research is less extensive. When you're not sexually active, you're missing out on these cardiovascular perks. But once again, these benefits can be achieved through other forms of cardiovascular exercise. A brisk walk, a bike ride, or a dance class can provide similar heart health benefits. Now, let's shift gears and talk about the psychological and emotional aspects, because these are often more impactful than the physical changes. Human beings are wired for connection. Sexual intimacy is one of the most profound ways we connect with another person. It's vulnerable, it's intimate, and it creates bonds through the release of oxytocin, often called the bonding hormone. When you're in a relationship but going through a period of sexual inactivity, this can create emotional distance. You might feel less connected to your partner, more isolated, or even question the health of your relationship. If you're single and not having sex, the emotional impact can be different but equally significant. You might feel lonely, wonder if something is wrong with you, or struggle with feelings of undesirability. In our sex-saturated culture where intimacy seems to be happening everywhere around us, not having sex can make you feel left out or abnormal. I want to be very clear about this. You are not abnormal. There are countless reasons why people go through periods without sex, and none of them make you less worthy, less attractive, or less whole as a person. One thing that can happen during long periods of sexual inactivity is a shift in self-confidence, particularly around your body and your sexuality. When you're regularly intimate with someone or even with yourself, you maintain a certain sexual self-awareness and confidence. When that stops, especially for extended periods, you might start to feel disconnected from your sexual self. You might worry that you've forgotten how to be intimate, that your body has changed too much, or that you won't be able to perform when the opportunity arises. These fears are completely normal, but I want to assure you that sexual confidence can be rebuilt. It might take some time and self-compassion, but it's absolutely possible. There's also the question of what happens in relationships when one or both partners lose interest in sex. This is incredibly common and can happen for so many reasons: stress, health issues, hormonal changes, medication side effects, relationship problems, past trauma, or simply life getting in the way. When sex stops being a part of a relationship, it can create tension, resentment, and feelings of rejection on both sides. The partner with the higher libido might feel unwanted or unattractive, while the partner with the lower libido might feel pressured or broken. This is why communication is so crucial. Talking openly about what's happening without blame or judgment can help you navigate these changes together. Let me address something important: masturbation. If you're not having partnered sex but you are masturbating regularly, many of the physical changes I've mentioned won't apply to you, or will be significantly minimized. Masturbation provides many of the same benefits as partnered sex: neurochemical release, stress relief, improved sleep, pelvic floor exercise, and maintenance of genital health. The main thing you might miss out on is the interpersonal connection and the specific benefits of oxytocin release that comes from physical intimacy with another person. But from a purely physical health standpoint, solo sex counts. However, if you're not having any kind of sexual activity, partnered or solo, for long periods, that's when you might notice more pronounced changes. Some people simply don't have a strong sex drive, and that's completely okay. If you identify as asexual or have a naturally low libido and you feel content and healthy, then the absence of sexual activity isn't a problem. The issues arise when the lack of sex is causing you distress, whether physical or emotional. So what can you do if you're going through a period without sex and you're concerned about the effects on your body? First, stay connected to your body in other ways. Exercise regularly, not just for cardiovascular health, but for the endorphin release and stress relief. Strength training can help maintain muscle mass and bone density, which are also supported by healthy hormone levels. Yoga or Pilates can help with pelvic floor strength and body awareness. Second, prioritize other forms of intimacy and connection. Spend quality time with friends and family. Physical touch doesn't have to be sexual to be beneficial. Hugs, cuddling with a pet, massages, or even holding hands with a friend during a difficult conversation all release oxytocin and help you feel connected. Third, don't neglect your mental health. If you're feeling anxious, depressed, or excessively stressed during a period of sexual inactivity, talk to someone about it. A therapist can help you work through these feelings and develop coping strategies. Sometimes what looks like a sex problem is actually a symptom of something else going on, like depression, anxiety, or unresolved trauma. Fourth, if you're in a relationship, keep the lines of communication open. Talk about what's happening and why. Be honest about your needs and listen to your partner's needs without becoming defensive. Sometimes just knowing that you're on the same team and working through this together can relieve a lot of the pressure. Fifth, be patient with yourself. If you do decide to become sexually active again after a long break, expect that it might feel a little awkward or uncomfortable at first. That's completely normal. Your body needs time to readjust. Use plenty of lubrication if needed, take things slowly, and focus on pleasure rather than performance. Remember, sex isn't just about intercourse. There are so many ways to be intimate and experience pleasure. I also want to address the role of hormones more directly because they're so central to this conversation. For people with penises, testosterone typically peaks in your late teens and early 20s, and then gradually declines with age. This natural decline can affect libido, energy, mood, and sexual function. While sexual activity can influence testosterone levels somewhat, it's not the primary driver. If you're experiencing symptoms of low testosterone, like persistent fatigue, depression, loss of muscle mass, or erectile difficulties, talk to your doctor about getting your levels checked. For people with vulvas, hormones fluctuate throughout your menstrual cycle, during pregnancy, after childbirth, and during perimenopause and menopause. These fluctuations can have a huge impact on libido and sexual function, often independent of how much sex you're having. Estrogen is crucial for maintaining vaginal health and lubrication. When estrogen levels drop, particularly during menopause, vaginal dryness and discomfort during sex become more common. If you're experiencing these issues, there are treatments available, from vaginal moisturizers and lubricants to hormone therapy. You don't have to just accept painful or uncomfortable sex as a normal part of aging. Let's talk about sleep, because there's an interesting connection here too. Sexual activity, particularly orgasm, promotes better sleep. The release of oxytocin and endorphins, combined with the physical relaxation that follows sex, can help you fall asleep faster and sleep more deeply. If you're going through a period without sex and you're also struggling with sleep, the two might be connected. Of course, the relationship works in reverse, too. Poor sleep can decrease libido and make you less interested in sex, creating another one of those cycles. If sleep is an issue for you, focus on good sleep hygiene. Consistent bedtime, cool dark room, limited screen time before bed, and relaxation techniques. There's also the matter of pain. For some people, particularly people with vulvas, going long periods without sexual activity can make sex more uncomfortable when you do resume it. The vaginal tissues might be less elastic, there might be less natural lubrication, and the muscles might be tighter. This can create a negative feedback loop, where sex is uncomfortable, so you avoid it, which makes it even more uncomfortable the next time you try. If you're experiencing pain during sex, please talk to a healthcare provider. Pain is not something you should just push through. There are solutions, whether that's pelvic floor physical therapy, hormone treatments, or addressing underlying conditions like endometriosis or vaginismus. For people with penises, extended periods without sexual activity might lead to more difficulty achieving or maintaining erections when you do try to have sex again, particularly if you're dealing with performance anxiety on top of the physical changes. Again, this is usually temporary and improves with regular activity. But if you're experiencing persistent erectile difficulties, it's worth talking to a doctor because this can sometimes be an early sign of cardiovascular issues or other health conditions. Now I want to address something that comes up a lot: the question of whether there's a normal amount of sex you should be having. The answer is that there's no universal normal. Some people are happy and healthy having sex multiple times a week, others once a month, and others not at all. What matters is whether you're satisfied with your sex life, and whether the presence or absence of sex is causing you distress. If you're in a relationship, what matters is that both partners feel their needs are being met, or that you're working together to find a compromise that works for both of you. It's also worth noting that going through periods without sex can actually be an opportunity for growth and self-discovery. It can give you time to understand your own body better, to heal from past experiences, to work on yourself, or to figure out what you really want from intimate relationships. Some people find that taking a break from sex helps them reset and come back to it with more intention and awareness. Let me also touch on the social and cultural pressures around sex, because they're real, and they can affect how you feel about your own sexual activity or lack thereof. We live in a culture that often equates sexual activity with health, happiness, and success. You see it in movies, TV shows, advertisements, and social media. Everyone else seems to be having tons of great sex all the time. But this is largely an illusion. Many people are going through the same dry spells you are, facing the same challenges and feeling the same concerns. You're not alone in this. The pressure to be sexually active can be particularly intense for young adults, but it doesn't stop there. People of all ages feel this pressure, and it can lead to unhealthy choices, like engaging in sexual activity you don't really want just to feel normal or to please a partner. I want to be very clear. You should never feel obligated to have sex. Your worth as a person has nothing to do with how much sex you're having. So where does all this leave us? Going through periods without sex can affect your body in several ways. Potential changes in mood due to shifts in neurochemicals, possible decreases in libido, minor impacts on genital tissue health, missing out on the cardiovascular and immune benefits of sexual activity, and potential effects on your emotional well-being and relationship satisfaction. However, none of these changes are permanent or irreversible, and many of them can be mitigated through other healthy lifestyle choices. The most important thing you can do is stay connected to your body. Maintain open communication with any partners you have. Take care of your overall health through exercise, nutrition, and stress management, and be compassionate with yourself. Whether you're going through a dry spell by choice or circumstance, you're still a complete, worthy, valuable person. If the lack of sex is causing you significant distress, if you're experiencing physical symptoms like persistent pain or dysfunction, or if it's creating serious problems in your relationship, don't hesitate to reach out for help. Talk to your doctor, see a therapist, or consult with a sex therapist who can provide specialized support. There's no shame in asking for help with sexual health issues. These are normal, human concerns that deserve proper attention and care. Remember, your body is resilient and adaptive. It's designed to handle periods of change, including changes in sexual activity. Trust yourself, listen to your body, and make choices that align with your values and your well-being. Whether you're sexually active or not, you deserve to feel healthy, confident, and connected to yourself and others. Thank you so much for watching, and I hope this information helps you feel more informed and empowered about your own health journey.